Well, now let's talk about those vet visits. In earlier videos, we talked about the reasons you go to the vet, the reminder cards, and because your new puppy needs shots. So let's talk about what we should be doing in those videos now that we've talked about how we don't really need to do all the things on the reminder card. So what should we be doing and discussing for your new puppy or kitten visit? So this is part one of what we should be doing. So your new puppy, let's not forget, the vet visit is good. The exam is good. Most vets are really good at examining new puppies and kittens and making sure that they're developing properly. So this part is good and easy. But we're not going to talk so much about the other stuff that wants to talk about. So you need to try to make sure that you talk about the things that we do need to talk about, which we're going to discuss or introduce here. So the modern veterinarian has a lot more to offer than just exams and shots. They do know a lot about puppy behavior and development and a lot of things for your puppy or kitten that you need to know if you don't already know them. So this is your chance to discuss them and ask questions. You need to discuss behavior and development times of puppies and kittens. In that first year of life, there are several different periods or phases where there's a certain time frame where if they're introduced to something unknown or scary, if it's the wrong time in their development, they'll be scared of it the rest of their life. And if we force them into it, they'll be even more scared of it. There are other times in their development when if you introduce them to something somewhat scary and encourage them and reinforce the behavior, positive reinforcement, then they adapt to it and they're never scared of it again. So this really does all depend on the exact timeline. And we weren't really taught that in vet school. A lot of vets have learned it and figured it out, and a lot of vets don't know anything about that. So there's plenty of books, there's plenty of information about that, but you need to be looking up the first year puppy timeline and the phases they go through. You may have noticed you teach them something, and then at like 6 months of age, it's like they forgot everything they learned. But it's more than that. There's certain phases in that first 6 months and even the second 6 months where thunderstorms or fireworks, depending on how it's introduced and the age it's introduced, they're either going to be scared of those things the rest of their life or they're going to be cool with it. So those are things we need to talk about and learn about in that first vet visit. The other things you need to do, you need to learn how to trim their nails and clean their ears and brush their teeth. You've got to start that when they're young, because when they're older, they're going to be scared of it or they're not going to like it. So you've got to start that when they're young. And most regular Western vets are going to discuss those things with you. So ask about it and they'll be happy to discuss those things. You can also look up like other YouTube videos. I've seen several videos of really good dog trainers who lay their dog on their back in their lap and trim their nails, and it's peaceful and it's simple and it's stress-free and it's great. If you're going to teach those things, you have to start out young and get them used to it as a puppy. So those are things you can look at also. Tooth development for your young puppy or kitten. We skip over this a lot in vet school too and as regular vets. The puppy teeth, the adult teeth that start coming in at 5 and 6 months of age, they're not fully hardened until about 2 years of age. So even though your 1-year-old young adult dog has all its adult teeth, they're not fully hardened. If you give that dog deer antlers and the hard white bones from the store that have been bleached and cooked, they're going to break their teeth on them because their teeth aren't fully hardened until 2 years of age. And most vets don't seem to talk about that, and I don't remember getting into that at all in vet school. So you need to know that. They need something softer than their teeth to chew on for at least the full 2 years, or they'll chip a piece off of their big back premolar, and then they'll have tartar on that their whole life, and you'll be dealing with their whole life. So there's also socialization. A lot of vets don't want your dog going out in public in that first 8 to 16 weeks while they're getting all their shots because they're not protected yet. That's a huge important time for development. Your puppy or kitten, if your kitten likes going outside or you have a safe place and a safe way to do that, they need to be interacting with the world at that age and learning what's normal. So this lack of socialization and this isolation during their period of their shots, that's bad for them. They miss too much opportunity to learn. So speaking of opportunities to learn, while you're at these puppy visits, and I do think even if you're not going to get the shots, you should take the puppy in monthly the same way you would if they were getting the shots. So the vet can check their development every month and make sure everything's going according to plan. I do think you should do that. While you're there, let them see the rest of the vet clinic. So here's what happens. You go, you take your puppy in, you're in the exam room. Every time you go, you're in the exam room, the vet comes in, you're in there with the dog, and that's what the dog's used to at the vet, dog, cat, whatever. Well, there's going to come a time when they're a year or two old or older where they're sick and you have to drop them off for the day, or they need a dental cleaning or a surgery or something and they get dropped off for the day. That's going to be the first time that they've ever been to the back or been in the treatment area, or that they've been there and you've left instead of being in the exam room with them the whole time. So on these puppy visits, they need to take a little tour of the clinic. They need to go to the back and get some treats and see that it's all okay back there so that they're more used to it when the time comes that they have to stay. So those are things we need to be doing on these initial puppy visits, puppy and kitten. And a new adult dog even. I'm talking about puppies, but if you have a dog from the shelter that's a year or two old, or an older dog, or you've moved and you're going to a new vet for the first time, your dog needs to kind of check out the clinic and have some level of comfort with it. So if they ever have to be dropped off, they'll be ready for that. Okay, so that's part one. There's a lot more. We'll get to part two soon. Thanks.